Hello everyone, and I am very, very delighted to introduce Dr. Rohith with all of you, who has achieved amazing rank of 63 in this NEET PG 2023. Heartiest congratulations, Dr. Rohith.
Thank you, ma'am. Thank you.
Right. Rohith has done from AIMS Bhopal, and he was there at Indore Center, right, Rohith?
Yes, ma'am.
Okay. So, Rohit, this was, I think, your first attempt?
Yes, ma'am. It is my first.
Okay. So, I think this is a very, very challenging thing that the students are able to achieve an awesome rank like this while preparing for the internship. So, I think this will be a very good message for all of the students that how did you started and how did you manage along with your internship?
Yes, ma'am. Actually, we at the AIMS Bhopal had a very hectic schedule in internship, and we have to go every day, and we will not be given attendance also if we bunk any session any day, and it was actually hard to manage both the internship as well as preparing for NEET or INISET, but whenever I used to get time during my internship. Even in the hospital itself, I used to open my app, whichever platform is I'm preparing from, and I would give tests, mini tests or subject tests or reviewing grant tests, and if possible, watching some videos, YouTube lectures and all. And and the remaining time, when I came back from hospital to hostel, I used to take a nap, and then I would resume my studies again. And, it was actually tough to combine both.
Yeah, it is actually tough indeed, but it's very good that you managed. So when did you actually started preparing for it?
I started preparing for competitive exams from the third year onwards, ma'am. And okay, like I started with the clinical subjects first, and then pre and paraclinical subjects. And later on, I came to know that pre and paraclinical subjects form a base to all the clinical subjects. And now, actually, for this NEET preparation, I didn't even study medicine much. I studied pharma, patho, micro, and physio, and most of the things were covered in of medicine were covered in that itself.
Okay. So, like we were talking, you said that you attended almost all the one-shot sessions that we did just before the NEET PG 2023. So, tell us your experience about that.
One-shot revision sessions actually gave what all are needed in the last minute of our preparation, and it also included some previous year topics and anticipated topics for the upcoming exam also. And the few subjects which I could not revise completely before my exam, I watched from that only, like forensic medicine, and that's it.
Okay.
It's a very good initiative actually.
So, did you think that those sessions really helped in concising the subject and for the last minute revision?
Yes, ma'am. Yes, ma'am. Actually, yes, they concise, ma'am. They were very helpful actually, and and we cannot revise everything in a short span of time to before exams, no? So it really helped me a lot.
So, did you get some questions from the one-shot sessions, Rohit?
Actually,
because students told us that many questions came directly. If you remember, there was KF ring, there was Buftalmos.
Yeah, actually, these kind of questions, no, ma'am. Actually, they were asked many times. So I could not remember exactly if I watched the thing or not.
Okay.
And I usually, whenever I watch a video or something, I usually prefer knowing only concepts and those topics which are tough to be remembered and all. And I also watched. I didn't watch any of the shoot shot session on live. Also, I watched only the recorded session, that too in 2x speed, to cut short the time that I used to watch videos.
Yeah, definitely. That is the advantage of YouTube videos, that you can see the recorded session at your convenience and at your speed, definitely, right? So, Rohit, you gave some tests also, the grand
Yes,
tests. So, how do you think was the quality of the questions and how much similar they were to the NEET PG 2023 paper?
yeah. Then, as far as GTs are concerned, there were few questions which are a normal level. Most of the questions were of normal level, and a few questions are there which are not of NEET level. But after seeing this year's NEET paper, I thought that it is better to do such kind of questions also. And I also felt that this year's NEET paper was kind of INISET paper only. That
More and
frequently
more
asked INISET.
clinical.
Yeah. They were more clinical, ma'am.
Okay. So, how do you feel was the paper? Like, some people said that it was easy, but afterwards they say, no, ma'am, it was tricky. Actually, options were quite close.
Yes, ma'am. Yes, really. I too felt for many questions there were two correct answers, and so I opted to choose the best out of the two, and that's how I.
So, do you think that if you practice more questions, give more of the test like this one, this will really help in acing the preparation?
Yes, ma'am. Doing questions from question banks and doing GTs will make a huge difference of what we score and what we get a rank. It really decides.
Okay. So, Rohit, how many revisions do you think are actually important and they are must before the exam?
I completely read all the subjects before INSET only, the last INSET. I revised the subjects for once before INSET, and between INSET and this NEET, I again revised the subject, and I revised most of the subject, not all, and for remaining subjects, I watched YouTube videos and all, and then I covered. And as I progressed from one revision to another revision, I could remember what all the topics that can be potentially asked and what were asked previously, and I focused more on those things. And the concepts which I tend to forget, I also focused on them more.
Okay. So, when did you started your internship?
I started my internship on January 1st, 2022, ma'am, last year.
Okay, so you were having full year because the paper is again in March. So more than a year, I think you were having. So when did you completed your first reading? You started from January itself?
Actually, I completed this preparation. So few subjects I did it for profs only, like medicine, surgery, obs gynae, pediatrics, PSM, and actually we have Optal, ENT, and CFM also in our final year only. I did all these subjects mostly during our profs only, and then in this 1 year I did pre and paraclinical subjects, and then by September, I have started revising all the subjects.
Okay, so in these 9 months, you brushed up the previous subjects and then you completed the other ones. So till September, you were there. Now, from the September to this 5th of March, how did you divided your time? Like, how many revisions more you could do?
I did 2 revisions, ma'am. One before INSET and one between INSET and NEET.
Okay.
And and I feel all the subjects equally only, and I do not ignore any subject. And I used to study like biochemistry for some time, and if I feel bored, or if I wanted to change the subject, I'll combine it with a short subject like anatomy, anesthesia, and or derma, or CFM with ophtha, like that.
Okay, so you think like 3 revisions are good enough to appear for the exam?
Not only revisions, practicing questions and doing GTs is also a very important part of preparation, I felt. And reviewing GTs, right? Not only giving GTs, and reviewing GTs is a very important part of giving GTs.
Yeah. Okay, so which subjects do you think have to be considered most? Yeah, like we cannot ignore any subject. We have to read everything. But which subjects should be given maximum time before NEET PG?
Ma'am, like actually, pre and paraclinical are forming a bulk of any paper, like whether it may be NEET or INISET. And now, maybe after this paper, it must be realized that pre and paraclinical subjects are more important than clinical subjects, and short subjects are also being asked more in this paper. And so.
Okay, so means we have to actually go through all the subjects
Yes, ma'am.
with the equal force. Okay. Now the last but the most important question, what did you actually revise in the last 10 days just before the examination? Like we keep on reading so many things, so many tests, so many reviews, but what to revise in the last 10 days?
Ma'am, honestly, I saw sessions on previous year questions and YouTube sessions only. I binge watched them actually on 2x speed, and I didn't give any GT in the last 10 days.
Mm-hmm.
I reviewed those GTs and those questions that I marked, which I feel that they can be missed when they were asked in exam.
Mm-hmm.
And that's it, ma'am.
All right. So you did not made any 20th notebook to revise in the last 10 days. You just kept on revising the PYQs, that means.
Yes, ma'am. Last minute, I only did pre-PYQs.
Okay. So any other important message or any important lesson that you learned from your journey and you would like to share it with us?
Yeah, ma'am. Actually, after writing this session, ma'am, I felt that this paper is more clinically, and also the clinical postings that we go during our second to final year, I learned many things from there which can be applied in this paper, and that's it, ma'am. Like.
Okay, so any message that you would like to give to your juniors or the future aspirants that you learned that you want to share?
Yeah, balancing.
Well, you said that attending the postings is important.
Yes,
you
ma'am.
said giving test is important.
Yes.
You said revision of PYQs is important, right?
Yes,
then you said that revision of all the subjects. We should not ignore any subject. Okay. So these are all the plus. These are all the do's. Any don'ts that you would like to say that stay away from anything or we should take care, anything that you would like to say?
Ma'am, like what I felt was like I was very I kind of disheartened or I feel depressed actually. Like, can I give this exam or not? And so these kind of things should be avoided. And exam will be exam for everyone, and everyone will be in the same state before exam.
Exactly. So basically, we have to stay away from that negativity and self-confidence and self-motivation is very much required, right? So thank you so much, Dr. Rohith, for sharing your wonderful journey with all of us. And I hope that many of these students will definitely be benefited with this. And once again, heartiest congratulations from whole of our team, DBMCI. And we wish you all the very